So my name is Julie Neto and I'm going to be demonstrating the blood transfusion lab skill. So first we have our orders and we're going to verify on the orders. The blood transfusion protocol is every 15 minutes times 4 when you start the blood transfusion. We're going to transfuse 1 unit of packed red blood cells. And then there's also diphenhydramine, which we've already given our patient because it asks for it to be given 30 minutes prior to the start of the blood transfusion. And that's just in case the patient has a reaction. The diphenhydramine is already in the patient's system to counteract that reaction, hopefully. Prior to going to the lab to request the unit of packed red blood cells, the lab people have already come up to do lab samples, and the lab samples have already been sent to the lab for cross-type and match. So I'm going to enter the patient's room, and the patient's name is Miss Blair Johnson. So once I enter the room, I'm gonna knock first, and then when you're in the room, you wanna sanitize or wash your hands. Once you're in there, you're gonna talk to Miss Johnson Blair. So I'm just gonna verify. Good afternoon, Miss Johnson Blair. My name is Julie Neto. I'm one of the nurses here on the med-surg floor. Your doctor has ordered for you, Dr. Quesada has ordered for you to get a blood transfusion today. And I just need to verify your first name and your date of birth. So your first name is Blair and your last name is Johnson, is that correct?
Yes.
And your date of birth is 7/11/1963?
Yes.
Okay, great. And you're not allergic to any other medications or anything like that, other than what you've already stated, correct?
Correct.
Okay. I also need to make sure that that Dr. Quesada has gone over the blood transfusion consent form with you and make sure that he's explained all the risks and benefits for your procedure. Do you have any questions at this time regarding your blood transfusion?
No.
Okay, I'm just gonna sign here as a witness that I witnessed that he did describe the procedure to you, risks and benefits, and that you understand it, and that you don't have any other questions or concerns at this time. So at this time, I'm gonna go to the lab to get, I'm gonna go to the lab to get the packed red blood cells for you. So I will sanitize my hands again as I leave the room, and then I will go to the blood. Prior to going to the blood center, I need to make sure that the normal saline bag is already hung and primed and prepped. So that way when I come in, since you only have 30 minutes to start the transfusion of the blood from the time you get it from the blood bank, I want to already make sure that my patient's supplies and needs are already set and ready to go for me to start the blood transfusion. So at this time, I've already primed the normal saline. You want to use the normal saline because it's isotonic and it's most compatible with the blood. So you don't want to use any other products at all that will cause the blood to break down and change in its cellular formation. So I've also back primed the Y tubing, so that way when I connect the blood to it, it'll already be back primed and the blood can go in. The filter is filled right above the filter, so that way there's a cushion for the red blood cells to drop onto, and then the normal saline will transfuse into the patient, but we're gonna keep this clamped while the blood is running because we only want the blood to run, not the normal saline. The normal saline is only used for priming purposes. So I would go to the blood bank and I would let them know I'm Nurse Jolene and I'm here for the blood for Miss Johnson. The blood bank is gonna give you a package of the blood with the blood bank slip. So you're gonna verify the blood. It's gonna be 1 unit of whole red packed blood cells. So you're gonna check the blood, make sure that there's no punctures or holes or discoloration that would be odd to you. You're gonna check on the blood bank strip the patient's name, and you'll check this with the lab personnel to verify, because you always need 2 people to verify the blood. So you're gonna verify, this blood is for Miss Johnson Blair, And then the date of birth for the patient is 7/11/1963. There's gonna be the blood bank number, which is T888970. You verify the MRN. You're gonna verify that it's B negative blood on the bag as well as the blood slip. And you're gonna verify that it's 1 unit of whole packed red blood cells, which is what is on here and what was ordered by the doctor. So at this time, you can go back to the patient's room. You have 30 minutes to start the infusion. So I'm gonna go back into the patient's room. Actually, while you're handling the blood in the blood bank, you would need gloves just in case of contamination. So I'm gonna go back to the patient's room. I'm gonna sanitize my hands again. I'm gonna put gloves on. And I'm gonna again verify information. Hi, Miss Johnson. I'm back with the blood. I just need to verify your information against your hospital ID band. So it's gonna be Miss Blair Johnson, date of birth 7/11/1963, and you have the blood bank ID number on your bracelet as well, which is T888970. And it's gonna be B negative blood. It looks like we have the blood that we need to start transfusing you. So at this time, you're gonna hang the blood. You're gonna, I'm just gonna demonstrate this because I don't want the blood to actually spill. So you're gonna spike the blood bag. And I guess that doesn't work very well. So you're gonna spike the blood bag, and with your tubing, you're gonna take off the side. You're gonna cleanse this area with alcohol. Sometimes it could have the alcohol cap. So you're gonna cleanse the area with alcohol. You're gonna use the flush to double check the patency that it goes in. So we're gonna check the patency and make sure that this is unclamped. So it goes in. You would also check for return of blood to make sure that the line is in prior to flushing. Once you flush, you're gonna disconnect it, clean the area, and you're gonna connect your tubing for the blood transfusion. Prior to starting the blood transfusion, you would have taken a baseline of vitals, the blood pressure, temperature, pulse, SpO2, and pain also as part of the assessment, just so that you will have a baseline, because after you start the transfusion, you have to monitor the patient for 15 minutes. And then at the 15-minute mark, you're gonna take a second set of vitals, and you're gonna compare them to baseline. And during those 15 minutes, you're gonna be watching the patient for any kinds of signs and symptoms of maybe a blood reaction like shortness of breath, pain, any redness in the area, any kind of rashes, anything like that. If one of those symptoms does occur, you're gonna stop the blood immediately. You're gonna disconnect the line. You're gonna take another set of vitals on the patient, and you're gonna notify the provider. If you cannot transfuse the blood, since it only has a 4-hour life, you need to return the blood and the whole line and tubing, if the patient had the reaction, to the blood bank, so that hopefully they can figure out what happened and where the reaction came from. You have to transfuse the blood no more than 5 mL in the first 15 minutes, because again, we want it to run slowly to make sure that the patient doesn't have any reactions in those first 15 minutes. After those 15 minutes, if everything is running smoothly, the patient is stable, the vitals are stable, there's no any kind of reactions, you can leave the patient, but make sure to continue to assess the patients. Do another set of vitals at 1 hour, at 2 hours, and then at 4 hours when you complete it, you're gonna take everything and you're gonna put it in the biohazard bag, and you're going to assess the patient's vitals again. And that is my demonstration on the blood transfusion.